Okay, no more pretty videos of dogs. Now we got to talk about healthcare. What are the issues with healthcare? Well, it's a monster. It's about $2.5 trillion in the U.S. economy. It's about 70% of the U.S. economy. 253 million people have insurance. About 47 million people don't, which is an issue in a society as affluent as ours. But even the people who have insurance face issues. Your premiums, your out-of-pocket costs, and if you're like most people and you have a 75% or 80% reimbursement rate, you could be financially devastated by an extended hospital stay. And the part that you don't see, the part that your employer pays, all the money that that employer has to pay for healthcare premiums, she's not spending on expanding or creating jobs. The Democratic Congress and the President have been very active in this area, and they've only been in town for about 6 weeks. They passed the SCHIP, the State Children's Health Insurance Program. They added $44 billion to the $25 billion baseline, and you are now eligible if you make up to 3 times the federal poverty level, which is about $63,000. That is actually higher than the U.S. median household income. There's also the Recovery Act, or the spending plan, that added a lot of money for things like paying people's COBRA premiums, bailing out the states with their Medicaid shortfalls, billions of dollars for cancer research, and money for something called comparative research effectiveness, and $19 billion for IT investment. I don't know why the healthcare industry can't pay for their own IT with the $2.5 trillion we give them every year, but it's in the bill. Then there's the budget. And the budget, more money for IT, more money for cancer research. The bill actually includes incentive payments to doctors to use the IT that we're paying for. And $630 billion to expand coverage and reduce costs. Now, that's great, but it is a lot of money, and it is a government solution. And it got me thinking about the government solution for poverty. We have lots of programs in this country to alleviate poverty. Pell Grants for education, Medicaid for health, student lunch, women, infant, and children, and temporary assistance for needy families. We have spent about $10 trillion since 1965. And what do we have? We have a poverty rate that's roughly what it was in 1965. If you graph it, on the Census Bureau did, this is the pink line, and it was 13% in 1968. It's 12.5% in 2007. So my question is, if that's the government solution for poverty, do we really want the government solution for healthcare?